We have with us here at the AI Med Talks here at the AI Med Conference, Associate Professor Blanca Gallego Luxan, who's at the Centre for Big Data Research at the University of New South Wales. Now, there's a lot of talk today, I've noticed, with a lot of the speakers, a lot of talk around what people are discussing with the clinicians and the AI specialists about what to do with this data and where we're heading. Now, you're the expert in the field. Tell us about what you're going to be delivering in your talk and why you're passionate about being part of AI Med.
Yeah. So just to start with, to put some context, when it comes to methods in data, with health data, I work in two different aspects of it, both of them quite interesting and some that have progressed more than others. So one is clinical prediction instruments, and the other is treatment recommendation systems. And today I'm talking more about treatment recommendation systems and about how far we are from the dream of having a system that you can ask questions about evidence in medicine, like epidemiological questions or questions about the effect of treatments in a way that is automated. Basically, this is what I'm discussing: how far we are from the dream, what are the things that we have achieved already, and what's left to do.
And how far are we? I mean, you're the expert. Are we talking decades? Are we talking, is it a matter of years before we can turn to all of our data and ask it questions and actually get some feedback that's quite practical? Are we a long way away from that?
So if you think of the system as a system used for research, so it's a system that is sort of not necessarily to be used at the moment the patient arrives in the clinic, but something that you can ask research questions to. So substituting the researcher and not so much the clinician. I think we are not very far from it for some questions. So, for example, we have access to large electronic medical record data for general practice linked to administrative hospital data. We have access to large data associated with records within the intensive care units. We are a bit further when it comes to electronic medical records from hospitals. So it really depends on what questions we're asking for. And of course, Australia has really good large population health data sets. This is perhaps the only situation where we are ahead from the rest of from the US and Europe, who are much more ahead than us in the sharing and extraction of EMR data. And this, of course, can play also an important role. So we are not that far if you look at it from a point of view of substituting some of the tedious job that clinical researchers like I do every day.
Yeah, and that's a good thing. I mean, no clinician out there is really particularly interested in doing data entry and then working out how to aggregate or sort out that data to get the answers out of it. That's good news. Where are we in terms of data and big data replacing humans in the scheme of things when it comes to healthcare? Or is that really not something it's in our best interest?
You mean replacing clinicians?
Yeah.
Well, we are already sort of replacing some aspects of clinical care. For example, in imaging, in radiology, that's perhaps the example that has had most success. Particularly if you look at what has been approved by the FDA in terms of AI technology, a lot of it is associated with imaging, reading images, because deep learning was actually started by looking at representation, images, of understanding images and then text, and not so much with other, EMR data, which this is more like a new application of deep learning. So I think in some aspects it's already happening, but of course we are very far from other things. For example, I work, as I was saying before, in clinical prediction instruments, and we do have technology to provide quite useful predictions, better than humans. However, we still don't know how to implement that in clinical practice.
Yeah, and there's also...
it's a lot of research to be done in translation.
That's right. It's the issue of what to do with the data when we've got so much of it, as well as trying to protect the confidentiality behind it as well. Is that where politics plays a little bit, and the human element is always going to be I guess, a stumbling block for the full development of AI, in your opinion?
No, it's not just that. It's not just public perception, of course, which I understand about the privacy of the data, but it's also the getting data out there requires a lot of infrastructure and therefore a lot of commitment and funding. And there is, then that's where politics starts playing a role, and who pays for it and how and all these kind of things.
And the appetite
and there's also the access, who accesses and for what purposes.
Indeed.
And because it's such a heterogeneous place where, a lot of data custodians with a lot of very different data sets, it just becomes really hard to have everybody on the table, basically.
Well, it sounds as though your expertise is exactly the sort of voice that we need to have in the discussion around the AI Med. Tell us a little bit more about how people can find out about your work and perhaps connect with you and make it part of the conversation.
Yes, so as you said before, I work at the University of New South Wales. I'm part of the Centre for Big Data Research in Health. And within the centre, I lead a unit called Clinical Machine Learning. If you search my name with Jonas W., I think probably I'm the only person with my long name. So it's very easy to find me. We love working particularly with clinicians to understand better how to translate some of our technologies to improve patient care. So anybody out there who's interested, you know where to find me.
Fantastic. Well, thank you so much for being part of the AI Med Talks conversation today, and we look forward to hearing from you at your talk later on this afternoon.
All right. Thank you.